Today is on a topic that I have been close to for many years. So I'm looking forward to hearing what we cover, and I'm going to ask my colleague Carolyn to give a quick overview before we then dive into the session. Carolyn?
Thanks, David. I will briefly give a little bit of information about the motivations and aims for this event. So according to the 2020 Global Nutrition Report, no countries are on target to meet all 10 of the 2025 Sustainable Development Goals global nutrition targets, and only 8 of 194 countries are on track to meet 4. Post-pandemic, progress against these targets is unknown, but expected to be further behind. So in the face of the pandemic, malnutrition has been called a threat multiplier due to its disproportionate effects on the poor and vulnerable, where inability to access micronutrient-rich foods increases susceptibility to infection and death. For children in the first 1,000 days of life, this may lead to irreparable long-term consequences carried into adulthood. Delivery of effective nutrition programs are needed now more than ever, yet it requires operating in complex and resource-constrained contexts. An implementation science approach can close the implementation gap by increasing the use of evidence-based practices, accounting for multi-level contextual factors, enabling the policy environment, and using empirical research, implementation research, focused on the coverage, appropriateness, and quality of delivery. So in today's session, we have 3 objectives. The first is to renew the discussion around implementation science and the use of implementation research in nutrition. The second is to highlight the ways that implementation research has been used in the design, planning, or implementation of nutrition programming. And the third is to leave you, our global community, with some food for thought on where the field needs to go and how we continue to foster the use of evidence-based practices in the field of nutrition. David, I will return the discussion back to you.
Great, thanks, Carolyn. And so now let's get into it. We're going to divide the session into 2 major chunks and also leave some time at the end. And each of the 2 major chunks will be a question, and we'll ask each of our panelists to give their thoughts on each question. I've already apologized in advance to our panelists, but just for everyone's benefit here, I will be a bit strict about time because we want to respect everyone's chance to come in. So my apologies if I have to cut someone off or urge them to wrap up. So the first chunk and the first topic is the following. How has your organization, this is a question to the panelists, but also good for participants to think about, how has your organization used implementation research to address the implementation gap in nutrition? What has been its value for implementation, decision-making, and learning? So let's start with Purnima, our co-sponsor from IFPRI of this session. Purnima, over to you.
Thank you. Thank you so much, David, and thank you to the 3IE team for pulling this webinar together, but also for your great partnership in developing the evidence gap map on implementation research in nutrition in India, which I think that was the foundation of our own partnership leading up to this event. So I'm really grateful for that. At IFPRI, we do a tremendous amount of implementation research across actually many of our research teams. So I just want to restrict my own comments to the work that we've been doing primarily in South Asia, given the backdrop to this webinar. So our work on implementation research in South Asia started, I want to say, back in about 2009, where beginning with global agreements and a lot of the evidence base on what interventions were effective, we began to look at the gaps in the reach of these essential interventions that had been agreed upon both by the global nutrition community and the nutrition community in India. And in fact, together with Sunita, I co-developed the Potion Initiative, which is really sort of focused on bringing evidence on the reach, the quality, the innovations, et cetera, around these existing nutrition interventions to the policy community. So when I think about the kind of research that we've been doing, it's been long range, and it's been very much in partnership with the entire nutrition community, if you will, in India. And then our work on Alive and Thrive has been, again, a sort of really foundational implementation research experience for me and many of my colleagues, and that has been done both in India and in Bangladesh. But our approach, in a sense, is to really use the full range of IR related methods, not sort of choosing or valuing just one method after the next. For example, we've done work with large-scale data sets, with public data sets, to highlight gaps in equity, reach, and geographic variability of interventions. We've done primary research to study program delivery, to understand uptake and the quality of delivery of interventions. And we've done this in India and in other countries in the region. And then last but not least, we've done a lot of evaluation research, which is really around testing innovations and testing new programs. And our research teams in the region have done this to look at behavior change communications. Again, big collaboration with Alive and Thrive there, looking at technology scale up, maternal nutrition, work on women's groups and nutrition. But for me, another sort of very big part of the implementation research has really been the work to engage the entire nutrition community. I think, especially given IFPRI's mandate to generate public goods and to put out our research in public domain, our approach has not really been targeting individual stakeholders around individual bodies of research, but to really engage the entire nutrition community and to get to tipping point, if you will, on recognizing the challenges, recognizing the value of implementation research, et cetera. In my last 1 minute, I just want to say also that, our experiences and our collective experiences, I hope, including of the implementers in partnership with whom we've done this kind of work, is that I think implementation research is critical in many different ways, because building knowledge around programs and scaling solutions is so important. But it's really important that we do this in partnership, sort of co-developing questions, looking at issues that are of importance to implementers, not just to us as researchers. The other critical insight is that resourcing of implementation research is absolutely critical. So without research funding, without sort of integrating funding for evaluations into big ticket initiatives, for example, like Alive and Thrive, we would never have the kind of resources that are needed to do the deep implementation research and engage closely with implementers as you do it. And then last but not least, even though we think about implementation research as just serving programs, documentation, writing up, and bringing that research into public domain by publishing in the academic literature, as well as in other spaces, I think is really, really central to the implementation research agenda. The legacy of knowledge that lies in the written world, in the world of research, is very important for all of us to invest in. And this is why having researchers committed to also writing and publishing, working in partnership with implementers and telling their stories is just a really, it's a big goal of how and the ways in which we also do our implementation research. So let me just stop there and hand it back to you.
Thank you, Purnima, and thanks for being so careful about time. You've laid out some very interesting themes there, which I hope will come up as we hear from the other panelists and get into discussion. Let's go now to Nita and your perspectives, Nita, from being at the Bill and Melinda Gates Foundation and your other work in your extensive career.
Thank you, David. And thank you also to the 3A team and Purnima for the opportunity to be here. Pretty excited to be on this very distinguished panel of folks who've been working on nutrition for a while. And I'm looking forward to learning as much as everyone else on this webinar. So at the Gates Foundation, one of the ways we work in the area of nutrition is with women's self-help groups. So implementing health and nutrition interventions with women's self-help groups. And typically we do impact evaluations, but for one particular intervention, we supplemented the impact evaluation with implementation research as well. This was about a couple of years ago in Bihar, and the evaluation was undertaken by our by Population Council, Dr. Abhishek Hazra and team, who are our evaluation partners. So there was an impact evaluation, but it was supplemented by an implementation study as well. And it came up with certain really interesting findings from our perspective, which really informed the programming strategy, but also, I mean, for that immediate program, but also in the longer term, it caused us to look at our program designs in a slightly different way. So for example, the implementation study pointed out that certain topics were covered during SHG meetings and during home visits, but not at VHSND events or similar type of events. We learned that target women, topic recall was actually higher during SHG, when topics were covered during SHG meetings and home visits. No surprise there, because I think it's the closer interaction with the women that allowed for better recall. We also learned that target women who are pregnant or lactating women and their mothers-in-law participated very intensively during home visits, but there was little engagement from the men in the household, which also told us that, okay, we now need to figure out our programming strategy in a slightly different way in order to be able to engage with these men who are an essential, who are an influence and a very important target group audience for us as well. We learned that there was and then because there was an impact evaluation supplementing the work that we were doing through the implementation study, with the benefit of hindsight, once the impact evaluation was over, we were also able to trace back and see that better recall resulted in better outcomes as well for some of the hard to move outcomes or behaviors as well. We also learned how much women enjoy multiple media being used. So they would specifically mention when the Didi came home, she talked to us, she used pamphlets and posters, etc. And they particularly appreciated, at least in this study, the videos that were played during SHG meetings, etc. All of these findings, I think, went a long way in helping us understand what, in some senses, what works for whom, and in some ways, what are the mechanisms that help us get there? How can we improve understanding? How do we improve recall when 100 different topics are covered and women are being bombarded with messages? And then what can we do to actually convert those to behaviors, covering the no-do gap that often comes along the way? And so I think it taught us that it's really important, we're moving away from just doing impact evaluations to also learning while the programs are being implemented. Impact evaluations take time, as we all know. And I think even for our government counterparts, it's often not enough that, we do a baseline in 1 year, we do the end line 2 years later. What happens in between remains a black box. And so for us, using implementation studies and process evaluations have been very valuable across the board. I'll stop there, David, and hand it back to you.
Thank you so much. Now we've got some very interesting topics before us from Purnima, who drew attention to engaging the entire nutrition community and building knowledge, partnerships, the importance of resourcing, and Nita, who helpfully walked us through some learning that you've done about what works, and understanding from that how we can do better going forward. So with all that, let's come now to Suneetha.
Okay, thank you, everyone. It's a pleasure to be on this panel, and also the attendees. I see many friends and many colleagues I know, and also several new faces. Thank you for this opportunity, IFPRI and IFPRI. So I just want to take a step back and see what we're trying to do in implementation research. So in implementation research, we are seeking to understand and work with the real world conditions in which context plays a central role. And implementation research is especially concerned with users of research in terms of, by users, I mean people, the policymakers and program implementers who need this information to continually improve their programs and achieve their objectives and impact at scale. So in actually structuring my talk, I'm borrowing from Peters et al. From BMJ, Global Health of BMJ, on how they thought about issues in implementation research. We are concerned primarily with four things. The first one is implementation strategy, implementation outcome variables, outcomes influencing variables, and implementation research questions. I'll take the first three in this iteration. And I would like to illustrate what we did on a couple of these points from the programs I led with many other partners, including on OPA1, which is a cluster randomized controlled trial of a nutrition-sensitive agriculture program with participatory videos and women's groups that involved 8 partners. It's a complex behavior change intervention trial where we aspire to catalyze change in both agricultural practices as well as dietary practices of women and children through a number of pathways. So what did we do in the rubric of implementation and implementation strategy? A key challenge in intervention design lies in deciding what behaviors to prioritize. And we heard there are hundreds and hundreds of behaviors we could consider prioritizing, and how best to promote them. Therefore, the way we thought about this with various partners, which took us in partnership almost 9 months to arrive at a theory of change and all the information that is required for theory of change. For example, published empirical evidence, we conducted a feasibility study, formative research, forming seasonal calendars, thinking of which behavior change model we would use, and also really using for our intervention team's local knowledge. As the intervention progressed, we mapped each of the behaviors that we are promoting in our interventions against these pathways which we have laid out in theory of change, and really trying to say, okay, how are we balancing where we are in our behavior change theory pathways as well as in nutrition sensitive agriculture pathways. So one of the key lessons I learned in this, engaging in this exercise beyond, of course, this pathways language and theory of change language, which we might be tired of listening to and engaging with sometimes, is that it gave us an opportunity to collectively agree on definitions of complex concepts and be on the same page across from the community leaders to our facilitators to the researchers in London. And we are able to communicate clearly such that after the first year, we could really, the local, by local, I mean our implementation partners who really actually do much of this work were mostly in charge of these major decisions and implementation strategies. So motivated by these lessons and the key gaps in literature that Purnima alluded, we actually did publish this in last year. And I must say, and I see Jan Low in the audience, one of our motivations for that paper was one of their papers on Mama Sasha project led by Donald Cole, Amy Webb-Gerard, and the whole team, Jan Low and team, on where they talk about how they have planned the implementation of the Mama Sasha project in Western Kenya. So I think we need more of that. And this is where I'm reiterating Purnima's thing of, unless we write and communicate in some permanent way, it becomes quite hard to learn from them, get motivated, and also to for others to learn moving forward. Then there are, of course, several implementation variables. In the last 30 seconds, I would just like to say that feasibility, fidelity, and acceptability, these are all important aspects of really trying to monitor. And one of the challenges we faced was, how will the implementation learn about coverage on an ongoing basis when the denominator, the 1,000-day women, as we call itself, is a moving target? And we had to really think through monitoring strategies around that. On context, which is important, we learned that, of course, context matters. And we specifically learned that our interventions are taken up by people who are already better off in their intra-household dynamics. So I'm happy to answer. So really, we need sorry, I need to, okay, I'm done. my clock beeped. As a last point, I was just saying that sometimes, therefore, our interventions have taken root much better in terms of uptake where the household conditions are already better off. And therefore, we really do need to think about the context and how we address the context in straight on, really, as opposed to that pesky little detail that we want to control for or just account for in some statistical sense. I'll leave it here. Thank you so much.
And thank you, Suneetha. So we now, from the three speakers so far, we're getting a very interesting interweaving set of thoughts about learning, it seems to me, which is at the core of making something work, figuring out why it isn't working, and understanding what the target population needs and how they think, and then how the researchers need to think. So we have a lot to build on here, but let's go to our last panelist now, Carolyn.
Thanks, David. So I just want to underscore some of the messages that my esteemed panelists have shared, and that is the appreciation for the local context and the implementing environment, as well as the importance of engaging stakeholders. Although 3IE has not done an extensive amount of work in implementation research, we've traditionally been focused on impact evaluations. I wanted to highlight some interesting findings and observations from a partnership that we had with our key technical partner, the Society for Implementation Science and Nutrition, and two implementing partners, URC and FHI partners. This was a collaboration called the Implementation Science Initiative, and it used a health systems implementation science approach to strengthen two existing maternal and child health anemia control interventions that were implemented in Uganda and Kenya. So in this initiative, there were two kinds of implementation research that we really used. So in Kenya, we had formative research and really conducted a literature review to better understand gaps in the contextual environment, refine the theory of change, and really think about effectively tailoring and designing programs in order to reach pregnant women who were perhaps not accessing, unable to access antenatal care. Unfortunately, with COVID disruptions, we were unable to move forward with the project, but I do think that the process of coming back to the theory of change and really refining the needs, the program to meet needs was an important step because oftentimes we work within very short program cycles where the pressure is just immediately to do something. And oftentimes the research can't catch up in order to make sure that the intervention is effectively designed. In Uganda, we conducted, URC and CISN and ourselves conducted a mixed methods implementation effectiveness study to examine whether an enhanced quality improvement approach could increase the availability of IFAS and the receipt of communication and health information about IFAS. And from these two pieces of implementation research and really knowledge gathering, we were able to engage stakeholders and really increase buy-in. And that is an important part of sustainability as well as appreciating and making sure that programs are adequately designed to target those that they are intended to reach. So I think what I'd like to highlight in this project is that in addition to focusing on the effective delivery of IFAS, we really engaged with key actors in a knowledge brokering process, and really also documenting and taking stock of bottlenecks that existed within the health system that may affect the delivery of these specific IFAS programs. And I think that implementation research was an effective tool to actually engage and increase buy-in.
Great, thanks, Carolyn. And we now have time, a short amount of time for questions immediately on this portion of the seminar, and then we'll have more time later on. And I'm going to mention two questions now, and they are addressed to anyone on the panel. And we'll let you choose. You don't all have to speak. There will be time for everyone to speak more towards the end. The first question is, how can implementation science be used to enhance programs targeting the first 1,000 days for child nutrition to avoid stunting? And it's elaborating on that. The question asks, in terms of being proactive rather than just being reactive and looking for treatment after the problem has emerged. And any successful examples would be welcomed in various countries. The second question is, again, asking for a specific example, in this case, of gaps that were identified during implementation research, and how the findings were used to address the gap. And a country example, for example, was there an impact evaluation also conducted, and how were the findings, the implementation research findings, gathered between baseline and end line? So those are two questions. A third has popped in, so I'm going to put that up as well. And again, to any of the panelists, and how to move the nutrition evidence conversation into the policy arena. What are the things we need to look into to have nutrition intervention be more prominent and acted upon and have an influence on policy and action? So I'm going to leave those three questions for our panelists, and who would like to pick one and go first? Well, I see, Sunita, you have taken your mute off, so you are ready to speak. Go ahead.
Well, I forgot to mute it, I suppose. I was just responding to one of the texts. One of the key gaps we find in the implementation research realm, if we interpret that as something that the people need in terms of making decisions, is the economic evaluation, especially in the complex program evaluations and or in that programming, multi-sectoral programming. It's a space that is still quite wide open, although there are some initiatives now led by the University of Washington. IFPRI is quite involved, and we are involved as well on improving economic evaluations of complex multi-sectoral programs. Mm-hmm. I'll leave it there. There are others, I'm sure, that will bring up other gaps.
Great. Okay, would the other panelists like to take any of the questions?
David, I'll respond to it. There's a couple of questions, sort of the last two questions on research for policy. That's, and how do you make evidence more available, accessible, et cetera. So, I think I go back to the pieces I said earlier, which is the writing in formal literature and, perhaps some, accessible forms that summarize, the more academic literature into program briefs, et cetera. I think those are important investments, and researchers and, their knowledge partners or implementation partners should definitely be doing all of that. However, when, one never knows when somebody in the policy arena has a question about a particular intervention, or when a policy window opens up to begin to bring in the evidence and things like that. And this is where I feel like having having sort of good partnerships or having available in the policy ecosystem enough people who are available to answer the questions that policymakers have is so critical. My number one experience in supporting the policy ecosystem with evidence is not that somebody has read a paper or a program brief and decided to do something. It is that someone in a policy environment has a question, and then they call somebody credible, somebody who's accessible to answer that question. What the literature does, what the program briefs do, in my view, is make available that information so that whoever is responding to a policymaker has all of that information available and handy. And I would hope that all researchers would be doing a little bit of that, not just answering policymakers' questions with the first thing that comes to your mind, but actually saying, hey, I know that some of this stuff is available, or let me take 2 hours or 2 days or 1 week or whatever it is to assemble the available information and get it to you. I think when we do it that way, the overall, the linkages are stronger, and we help to create a flow, if you will, of knowledge and an appreciation for the published knowledge that sits out there, as opposed to a researcher's opinion. So I have a lot to say on that particular topic of how we researchers can be better and more credible and more supportive to the policy environment, but also how we can support and our own research colleagues and counterparts by connecting policymakers to their work if we don't have the answers as individuals. So I think we have to create that entire setup of being accessible, being available, but also drawing on work, not just that we've done, but that others have done as well. Thank you.
Great. So the answers from our panelists provide a great segue to the next part of the session here. And hold on to the questions and the comments that we've heard so far so that we can come back to them at the end. The next segment is the question or two questions we're going to put to our panelists are these. How can we continue to build the body of evidence and increase uptake? So here, this intersection between research and policy comes up again, the uptake part in a very big and important way. And second, somewhat related, but somewhat separate and very topical, is how has COVID, the pandemic, increased the need for and relevance of approaches based on implementation science? What is implementation science giving us, or has the potential to give us, that we wouldn't have otherwise? So we'll go in the same order, starting with Purnima.
I should go on unmute. So let me, I think we should, I want to talk about the we, who is the we in the implementation research, and how can the we be most useful to the policy ecosystem? And I think in the context of COVID, where travel has stopped, and above all, I think what we have seen is that national counterparts who are trying desperately to do the right things to respond to the COVID pandemic, to respond to the impact of lockdowns on people's lives, on health services, etc., have really leaned on local researchers and local research networks, because these are the people that are there. Nobody is flying into any of our countries to bring expertise from anywhere else. I mean, of course, there's phone and WhatsApp, and we know that many researchers from around the world have been supporting responses in the countries that they're in. But this is something that I really felt and saw last year. And in the context of COVID, one of the things that the nutrition and the nutrition research community and the broader research community around India managed to do was to bring together a COVID-focused research network, which is hosted in India by a secretariat that's funded by the Gates Foundation, but really brought together 40 to 50 research organizations that were primarily based and working in India and were really focused on understanding the impact of the lockdowns and other aspects of the pandemic on health and nutrition services, on social safety nets, et cetera. And I think what we found was, this incredible collaborative spirit came through in the context of COVID that did not exist in the same way before. I think researchers are quite competitive, but in a sense, working together on this problem of what COVID was doing created a very, much more of a collaborative spirit. And I think we were able to do a lot more work together to say, well, what does this mean for our issue at hand? What are we learning about implementation? One of the things that our group did within that, the nutrition and food security, et cetera, group, is we've done work on prioritizing how to measure food security. A network of researchers, came together to do work on disruptions to health and nutrition services. That has, in the course of the last year, been fed back fairly quickly to state governments and other nutrition development partners, et cetera. So I want to say, in a sense, for me, the COVID situation has created both a lot of challenges, but also really created opportunities and an intent to collaborate even among the knowledge partners who have typically been more in competition. And, we are still seeing that unfold. We still need to work together because the problem and the challenges that lie ahead are really profound. We have seen huge disruptions in maternal and child health services. We don't have the solutions in place. We don't know whether the current solutions are working or will work as well. So I think there needs to be a lot more research collaboration. But I think, what I'm also seeing, unfortunately, especially in the last several weeks, is that the research community in India has also been affected by the pandemic. And this has been a time when we've been able to lean on global partners, partners outside of India who've been strong collaborators in the past, who perhaps haven't been as affected by the pandemic or are somehow in a better place. So for me, this phase of the COVID pandemic has also highlighted, the value of working together across borders, if you will, to help bring evidence and research and, hold the fort for each other if needed. So let me stop there. I think we're still learning about what works even to support the implementation ecosystem, at this point in time. And I think we'll have a lot more to say in coming months and years. But I think all of us are learning, adapting, and just trying to do, our best as, both as researchers and researchers who want to support the policy ecosystem. Thanks.
Great, and nice to hear that collaboration is happening. That's terrific. Nita, your turn.
Thank you, David. And I'm going to happily piggyback off some of the stuff Purnima said, because I think stuff that she said, I found myself nodding away because those have been our experiences as well. So number one, I would say, what can we do to build a better body of evidence? I would say the first thing on my mind is focus on measurement. What exactly are we measuring? If two studies are talking about a particular indicator, are they saying the same thing? If we are talking to people about indicators that are self-reported, are we collecting, some measure of, are we collecting with some measure of accuracy, or are we hearing what people think we want to hear, right? Which is always a concern in self-reported, which is always a concern with self-reports. How do we triangulate that stuff? Like, how do we try and use different methods to check whether the information we are gathering makes sense or holds up? Some part of that could be by collecting hard outcome data. So for example, anthropometric indicators, there are challenges with that, especially if we're thinking about children, for example. Evaluators are notably hesitant. How do you train survey teams to be able to do that accurately across, at scale or in large samples? I think those are some of the challenges we've looked into, and continue to grapple with. And I also know that there are teams such as Suneetha's team and the UNICEF study as well, where some of these questions are being explored or tested. And I think it would be great to kind of use those to build more robust evidence. A second point I'll make is something Purnima spoke about as well, which is, can we do shared studies in collaboration? Sometimes we see within the same state, we have multiple teams collecting data. Is there a way to collaborate such that we can get a bigger bang for our buck by expanding our sample, or by selecting a list of common indicators, maybe agreeing on a list of common indicators that can be collected across multiple studies and therefore compared and synthesized? Could we post data out in the open space, which is quite a scary proposition for many researchers because it comes with its own share of challenges? Are there ways to share data so that other teams can also make use of them? Would be another thing to think about. And finally, I will say at the foundation, we do invest in a number of third-party evaluations. And so from that perspective, I think I would highlight that evaluations are, in my experience, are often inconvenient. And I would argue perhaps they need to be so. Because if evaluations are telling us what we knew at the start of the program, maybe we are not learning much, right? And so for us to be challenged, for us to be thinking about, hey, but that's not the assumption I made when the program was first hypothesized, or our theory of change says something completely different. Maybe one perspective of evaluation is that it should challenge us and our thinking and our assumptions. Yet at the same time, that can also affect uptake, especially when it's a third-party evaluation, because it's challenging, I think, for program teams and evaluation teams to sort of come together and figure out, what is the data telling us? What are we learning the right things? And the only way to get around that problem is to design the evaluations and continue to work very, very closely with the program teams, because they have perspectives that enrich the evaluations, its design, its data collection, and the data analysis process tremendously. And I think I've learned a lot from having program colleagues involved at all of these stages. And it's something that I would highly, highly recommend, because then the evaluation doesn't sit getting dusty on some bookshelf. You have the joy of watching that taken up at the policy level, at the programming level, and what could be more rewarding for all us researchers and evaluators. I'll stop there, David.
Thank you, Nita, for that good reminder that evaluations can be, in fact, perhaps should be inconvenient and challenging, and make us work more closely together. Terrific. Suneetha.
Great, thank you. So for me, the questions, there are two parts, right? How do we continue to build better research, and how do we ensure its uptake? For me, in the implementation research methodology, the key question is, in addition to, of course, embedding process evaluation and different methods of study within a large impact evaluations, typically what we do, is also then how do we continue to build on low cost and easy to implement strategies for learning. I don't want to use the word evaluation here, especially from large programs, because these programs continue on whether any one of us is here or not, for many governments. And they want us to often say, okay, how is the program working? And typically we are like, have you randomized? Is there a quasi-experimental? Can I get an instrumental variable? So on and so forth. And the lack of, as you go, the hierarchy of causality, our enthusiasm suddenly wanes for engaging with the discussion from an academic perspective. So for us, one of the things that we have been thinking about is my research, our teams here is on low cost, feasible, but still methodologies where randomization doesn't exist. So one of the examples here is that we are working with Digital Green, with their National Rural Livelihood Mission partners on a program called Samvad, funded by USAID, which is a participatory video program, again, on behavior change. And it's implemented in diverse ways in diverse states. And there is, of course, as Digital Green or main implementation technical partner doesn't actually have control on exactly what's going on as you would have in an experimental study. But then yet they would want some learnings from this. How do we continue to improve our program? Are we reaching the people we want to reach or not? Where are we reaching? Where are we not reaching? What are some of the issues that we are facing? So what we thought we would do in this context is use it as a learning opportunity for us and for all the teams in a methodology using lean surveys with statistical process control methodologies. And what we learned here is that actually it can be done low cost. And actually our partners do much of the research. We have set up the systems and we have trained them, but we don't conduct much of the research. We have set up the analysis plans, and much of the report writing and even reaching out to their stakeholders all happens, and problem solving based on that data happens from the program teams that they have. And there are many other methodologies that we need to continue to innovate. For example, we have just concluded a study on market-based interventions for improving availability and affordability of vegetables in Bihar to nutritionally vulnerable markets. And there we have used system dynamics modeling to help us understand what is needed to actually to make this happen. How do you ask someone to sell it in a rural market where the price, maybe there are different risks with that, as opposed to just going to Patna, the nearest town, and selling all these vegetables. And but what we found is that while certain of these market-based interventions that we have tried, they could work. Again, this is a modeling exercise, which there is a potential to then test this out in a different way, in an experimental way, is that you need bundles of interventions and incentives to actually divert these vegetables to nutritionally vulnerable markets to keep them safe and keep them affordable. And of course, now we have all the sustainability and equity angles to that as well. What we also find is that there are huge implementation research gaps, especially in nutrition sensitive agriculture and food systems realm. We did a massive, very difficult 2-year-long evidence and gap map on tools, methods, and metrics in the space with Campbell collaboration. And actually implementation research remains a key gap. And through IMANA, we were hoping to catalyze some of this research before the ODA cuts, but we remain hopeful and watch that space. Finally, on the uptake, I agree. There was a question about, we keep talking about just papers, and that's true. For, I think, institutional memory, that remains important beyond other reasons, of course. But there are many other ways and avenues to engage with this learning and sharing process. For example, we convene the Agriculture, Nutrition and Health Academy, which cuts across disciplines in order to facilitate that. And it's not about just a talk shop in terms of we all present and we all just say this happened, that happened, but also how do we train people to do this kind of research? And we organize training sessions, not just on implementation research, of course, in this context, but also on many other topics. And for us, for featuring implementation research, for example, at our ANH Academy Weeks is there. So I think more of us most nutrition conferences currently also have this avenue. There's a whole society on this. So I think we are finding more and more opportunities and avenues, and we need to seize that opportunity and deliver upon it. I don't know how we would proceed. I think the time has passed, Nita, in terms of not sharing the data and not making it open access. That ship has sailed, regardless of whichever academic is concerned about that. So we are, the open access data is a requirement and should continue to be a requirement for to be out there and for people to use it. So I totally hear you, but I hope you feel a little more encouraged about that. Thank you so much.
Thank you, Suneetha. So we have 7 minutes left, and we're going to try and respect calendars and end on time. And so we have Carolyn to speak at the end of this segment, and then a few minutes for Q&A at the end. So Carolyn, go ahead, and then I'll read some more questions that will come in, and we'll give our panelists one more chance to say a few remarks, of course, quite briefly. Go ahead, Carolyn.
Thanks, David. I think my colleagues have covered so many useful insights. One that I might want to talk about is focusing on another aspect of the implementation ecosystem and stakeholders. And I think that is just reflecting on the tension between the scientific community and practitioners, and how we effectively communicate to encourage research uptake. I think that the scientific community tends to get very technical. And so maybe for thinking about for practitioners, how do we provide tools that are accessible, timely, and responsive to the context? I think one thing that was really interesting about the implementation science initiative that I mentioned was that our partner CISN had developed several tools on how to use evidence to strengthen program implementation. This includes, eliciting, engaging stakeholders to document bottlenecks and potential solutions, and how to use formative research methods like scoping reviews and focused ethnographic methods to incorporate global knowledge within programming. The second is perhaps a comment about tools that are effective for working with policymakers and decision makers. So 3IE has partnered with all of the organizations that are speaking in this panel today on several evidence gap maps. Purnima mentioned our implementation research gap map that was funded by Gates Foundation. And we've also partnered with Amana on a GIZ funded evidence gap map within nutrition. And I think one of the benefits of providing a simple visual and interactive tool is that policymakers can very easily understand what is the evidence underlying this specific interventions and outcomes, and where might evidence be scarce, and under what context has it been successful or not. And so I think these are some of the more practicable ways that we can try and build the evidence. Thanks.
Right. Thanks, Carolyn. So the last questions that have come in, one is for you, Purnima, and it is about implementation research and how many times we have to do it. I think is how many times should we do it before we say that's enough? This is a question, I guess, about repetition and validity. And the other question is for any panelist, and it's about context. To what extent should context play a central role in our implementation research? So let's start perhaps with you, Purnima, if you don't mind, and then we'll see if others want to comment on the questions or anything else we've said today. We only have 3 minutes, so please be brief.
All right, great. So I would say that we don't need to necessarily repeat the impact evaluation types of implementation research over and over again, but I would argue that any program requires or would benefit from, I'm not going to say requires, would benefit from concurrent implementation research partnerships, because there are always implementation bottlenecks. There are always things that prevent, full-scale uptake of programs. And without a knowledge partnership, it's often difficult to answer all the questions that often even implementers have year on, year out. I think the nature of the kind of implementation research will change as we gain bodies of knowledge about certain kinds of interventions and what they can deliver in a sort of impact perspective. But I would really say that any sort of well-run program invariably has a lot of knowledge and knowledge partnerships that run along with it. The nature of that should be driven by the questions that are important at that point. in time or in that period of time or in that context. So I'll just leave
Great.
it at that and say, we
Great.
should invest in creating that.
Thanks. And of our other panelists, anyone like to come in at this point? Last comments?
I answered the one in context there, so I think that should suffice.
Yeah,
for my
the chat.
viewpoint.
There have been some great comments in the chat, by the way, for everyone, including, I think, from you, Sunita, saying that EGMs are addictive, which is nice to be reminded of. Any other last comments, Nita or Carolyn?
I'll just make a pitch for something I mentioned in the chat, which is a heavy responsibility that all of us researchers and evaluators carry about translating evidence in meaningful, simple ways. I've been at presentations with policymakers where, when we start throwing around terms like RDD, odds ratios, we've lost them. And so we want evidence uptake. Let's speak in normal language. I'll stop there.
Great reminder. Carolyn, any last comments, or do you feel you've covered everything? Nope. Okay. So I think we made it on time. Thank you to the panelists and to all of those who organized and to all of those who participated and sent in questions. We covered a lot of good ground and had a lot of ideas for following up on. And I will just leave one comment, which is, if we were to do a next step, we don't have this plan yet, but it certainly comes to mind based on what we said today. It would be nice to have a bunch of practitioners in this conversation and hear from them. What do they want? What do they think they know? How can we be more responsive to them? And how can they help us? So with that, I would say thank you again to our panelists and call this meeting to an end. Thanks. Bye.
Thank you all.
Thank you.
Thank you. Bye.